Kawadhi wechego mag thieth en ni piny Kenya odonje winjruok gi riwruoga pinje Afrika mano AU kanyakla kod Kenya Redcross e tiego nyamreche maromo 25,000. Kokale chenro midendo ni rich, tiegruok ni ng'iyo mar medo nyamreche motiegi nyaka 2,000,000 kochop higa mar 2029. Gidhi yudo puonj e wi tiyo gi mashinde mag thieth makonyo gi chwalo tijegi e kind puonj mamoko. Piny Kenya kokale migawo mar thieth osendiko nyamreche maromo 107,831 ka idhi tiegi e tielo adek. Jalup direkta mar thieth Laktar Norbert Abuya owacho ni mae dhi konyo e chwalo chenro mag thieth ne gwenge duto pachoka.
Framework of the government in the public health space and general humanitarian space. And that is why this partnership is one part of the wider partnership of strengthening the healthcare system in the country in collaboration with the Ministry of Health. And it's a partnership that we are really proud of. So for me, this morning is to put on record our commitment as an institution that we intend to discharge our auxiliary role in strengthening the health system in the country, and will continue supporting that particular objective.
The CHPs have done a good job since the launch of the program on 20th October 2023 by His Excellency the President. This aligns perfectly with the 2017 African Union strategy to deploy 2 million community health workers across the continent, and the REACH initiative by the African CDC and IFRC. The objectives of REACH align with our Afya Nyumbani agenda that will largely be driven by the community health promoters. As we embark on this journey, let us remember that our vision is a future where empowered CHVs play a central role in fostering healthy communities and building resilience